I'm your host, Davina Shinsky, and you're listening to Live Without Limits, Dreams Come True with the Right Mindset. Today's presentation is titled Anxiety and Depression Can Go Hand in Hand. How do you know? Well, years ago, I struggled with quite a bit of depression. What I didn't know at the time was that underneath that depression, there was some anxiety lingering. I didn't feel it as much because I was feeling so low and lethargic. I didn't really have the gumption to get up and do much at all. However, after educating myself and getting some professional help, I learned that sometimes there are similarities between anxiety and depression. Oftentimes, there is a link that goes on between the two. It can be helpful to understand both conditions so you can get the help that you need in today's world. And there are many helpful treatments in the community and online. The days of COVID 19 caused many psychologists to start offering their services online via video. So this makes it much easier. Now, what is anxiety? Anxiety is a state where a person is in a state of worry, tension, and apprehension. It is a psychological term that is emotional response that is known or unknown causes that may range from a normal reaction to an extreme dysfunction. The latter can be indicative of an anxiety disorder. High amounts of anxiety can impact many areas, including daily life, relationships, decision making, and quality of life. It's the worst case scenario. A person may develop one of the anxiety disorders, which are a group of mental disorders characterized by intense anxiety and by manipulative behavior designed to relieve the anxiety. They include separation anxiety disorder, post traumatic stress disorder, social anxiety disorder, agoraphobia, generalized anxiety disorder, obsessive compulsive disorder, substance induced anxiety disorder, and specific phobias. How do you know if you're struggling with anxiety? That is more than normal anxiety, but most people feel at times. The following are some signs and symptoms of anxiety. Signs and symptoms of anxiety are feeling powerless, feeling apprehensive, feeling a sense of impending danger, doom, or panic, breathing rapidly, having increased heart rate, trembling, sweating, feeling tired and weak. Treatment of anxiety. Anxiety can be treated medically, independently, or with psychological counseling. Ultimately, the treatment method depends on the plaintiff's preferences and the cause of the anxiety. More often, the treatment will consist of a combination of behavioral therapy, psychotherapy, and medications such as diazepam, alprazolam, lorazepam, and clonazepam. Sometimes anxiety and depression go together, although alcoholism or other coexisting conditions can have a very strong effect on the person. So, treating the anxiety disorder sometimes must wait until the other coexisting conditions are brought under control. Now, before I get into depression, many a times people who suffer from anxiety are more neurotic because they can go on with their everyday activities, although people who suffer depression may even be considered psychotic because it's mental illness. And under mental illness, it's a neurological disability, and it's something where you actually need treatment in order to deal with it. So, what is depression? Depression is known as a mental disorder characterized by feeling very low, losing interest in life or things once enjoyed, feeling lethargic, sleep problems, poor concentration, and other symptoms. Depression is more than feeling sad for a few days. Clinical depression will linger on for weeks or months. It can be a low-grade clinical depression, or it can be intense, deep depression. Anxiety and depression may occur together. The above problems can become recurrent or chronic and lead to substantial impairment in an individual's ability to take care of their everyday responsibilities. When depression is at its worst, it can lead to suicide. The different forms of depression include major depression, persistent depression disorder, psychotic depression disorder, postpartum depression, seasonal affective disorder, and bipolar disorder. Are you struggling with minor or major depression? The following are signs and symptoms of the depression. Signs and symptoms of depression: persistent, anxious, and sad feeling, decreased energy and fatigue, feelings of worthlessness, guilt, and helplessness, restlessness and irritability, feelings of pessimism or hopelessness, loss of interest in hobbies or in activities where once that were pleasurable, and this includes sex, difficulty in remembering details, making decisions, and concentrating, excessive sleeping, insomnia, or early morning wakefulness, thoughts of suicide or suicide attempts, overeating or appetite loss, headaches, aches and pains, cramps, or digestive problems that don't stop even with treatment. Treatment of depression. Depression can be effectively treated even in people with severe depression, yet the treatment is usually more effective if it's stated or started before the depression gets so severe. A depressed person must first visit a doctor or mental health specialist. Certain medical conditions, such as viruses or a thyroid disorder, and some medications can cause the same symptoms as depression. A doctor can rule out these possibilities by doing an interview, a physical exam, and lab tests. If the disorder doesn't find any medical condition that may be causing the depression, they can then do a psychological evaluation. The doctor may refer the depressed person to a mental health professional who would discuss with you the complete history of your symptoms. The mental health specialist may also discuss with the family history of depression and mental disorders and possible alcohol or drug abuse. It is important that the patient be completely open and honest about his or her life and symptoms so the professional can make a correct diagnosis. Once diagnosed, the person with high anxiety and depression can get treated using several methods. The most common treatment are psychotherapy and medication. Medication is typically used for a last resort, but a combination of talk therapy and medication is common for severely anxious or depressed people. There is hope for overcoming anxiety, and depression. Many people have been successfully treated for anxiety and depression. Even beyond traditional therapy, there are many alternative treatments that can help alleviate or minimize symptoms also, such as acupuncture, meditation, mindfulness, breath work, and other modalities. If you are or a family member are struggling with anxiety or depression, don't be afraid to reach out for help from a medical provider or a clinical psychologist. You do not have to suffer, as there are effective techniques and therapies designed to help you live a happier and more peaceful life. So take the first step today to live a better life. And here's the last thing that I'm going to say about it. When you have anxiety or depression issues, it is important to seek out help. And there's minor things that you can consider that do affect who you are and how you relate. And if you come from a family where your parents were mentally ill, it's more likely that it's genetic. And even though you may not show the symptoms early on, it may show up later. So always be aware that if you want to live a better life, take care of yourself and take care of your mental state so that you can live the best quality of life possible.